Good afternoon and welcome to our Focus on Facebook Live. My name is Hussein Kermali. I'm the Chief Medical Officer here at St. Mary's Hospital in Waterbury, Connecticut. And welcome this afternoon. Each month we like to highlight one of our clinical areas and showing the services and expertise that we have available to our patients and the community at large here in Waterbury. And today I'm really excited because we get to welcome our primary care and our primary care chief.
Oh boy.
In the Waterbury, as well as the director of quality for Trinity Health and New England Medical Group, Dr. Josh Mosdale.
Thank you. Excited to be here.
Thanks for taking the time out of your busy schedule
Oh,
to
my
join
pleasure.
with us. So multiple hats: chief of primary care, director of quality. But out of all of that, you still serve as a primary care physician to patients. And let's talk about first you as a person. What brought you into medicine, and then residency, and the decision to be a primary care doctor?
Sure. Well, I think that like most of us, medicine always comes out of a desire to, I think, serve and care for people and to teach. And those have always been, I think, the things I enjoy the most. And when I went to college locally, Central Connecticut State University, I kind of initially was an English major, and then I bounced around a little bit and ended up with a finance degree, but took all the pre-med classes.
Wow.
And then I wasn't sure what I wanted to do, so I worked for Aetna Insurance Company for a little bit, and at the same time started working towards getting an EMT certification.
Gotcha.
And then I worked as an EMT while finishing up more of the pre-med requiremements, and just really kind of fell in love with healthcare, and that is what prompted me to go to medical school. And then I think as primary care, my always biggest desire has been to care for folks who are in my own community.
Yeah.
And as someone who was born in Britain, Connecticut, this was a great opportunity for me to directly care for people in my community in the state of Connecticut.
And you actually came to St. Mary's Hospital for your residency.
I did, and that's part of, again, me wanting to be in my community within Connecticut. So I've been in the system now for about almost 10 years. Which has been great. I've gotten to watch us grow quite a bit.
Yeah.
And it's really been a great journey.
So, finished medical school, came to St. Mary's Hospital to do your internal medicine residency, but then you chose primary care. What made you make that decision? Because a lot of people, as they go through internal medicine, maybe not a lot, but there is a certain amount of people that say primary care is not what I want to do. I want to have a life. I don't want to have my phone ringing at 10 o'clock at night. And the old mentality of the general doctor, as compared to the specialist, the cardiologist, the nephrologist, the heart doctor, the kidney doctors. What made you choose primary care?
Well, I think, like a lot of physicians, one is that your mentors tend to drive you a little bit.
Yes.
And here at St. Mary's, we continue to have excellent physicians who were my mentors.
Okay.
And pushed me into internal medicine because I think people do have that incorrect view of what a primary care physician does sometimes, and they think that it's not 1965 anymore where you're kind of running back and forth to the hospital and admitting folks at night. Now it's really more office-based during the day, and you pretty much are doing the 8 to 4:30, 5 o'clock, caring for your patients that way, and then partnering in a lot of places, with larger healthcare systems for the needs of your patients, whether it's a specialist, a hospital, etc. So I think being part of a system, my mentors, and then obviously, just enjoying interacting with the community in that way as a physician, that's all what kind of put me here.
So primary care physician, quarterback for the patient on their healthcare journey.
Certainly.
Back to the patient. Tell us about how you play that role for your patients.
I think that as an internist, the major things you do are preventive care, diagnosis, and then we prescribe patients medication, right? And if there's something we're not sure, then we see a specialist.
Yeah.
But in general, we're really good at figuring out what's going on with you.
Yeah.
And we know the patient the best. So a lot of times I'll have patients who, I'll see them, maybe diagnose them with a new problem, and they'll come back to me, and maybe it's the orthopedic surgeon, and they'll say, do you really think that I need surgery? Or is this the correct approach?
Yeah.
And sometimes it's far beyond my technical expertise, but I appreciate the fact that the patient has that relationship with me. It feels comfortable enough to make sure that all aspects of their healthcare, whether it's going on at a hospital, a specialist, or with me, I'm involved with and giving them advice about.
And that's the beautiful part, I believe, from a primary care physician? Because I know even I did when going through my residency in internal medicine, and even in medical school, when we were at primary care offices in our continuity practice, it was amazing to see the relationship, the social relationship with the primary care physician.
Yeah.
It's more than just the meds and the medical. It expands beyond that to the person.
And I think that I think even primary care doctors tend to forget how deep that relationship could go, because I tend to take care of whole families.
Yeah.
And you kind of forget the idea that there's a family somewhere sitting around a Thanksgiving dinner table, and someone says, well, I've been feeling sick, and the whole family's going, oh, we should call Dr. Mosdale. Have you called Dr. Mosdale? Because you take care of the whole family. And
right.
They talk about you,
yeah.
And when you see them, you know their family, and their kids, and what's going on in their life. And, it really is, I think, a really great way to receive healthcare, but also have someone who you really, really trust. And it feels like a part of your family to care for you.
One of the challenges that we're facing in healthcare today is that people don't have the primary care physician that they need. So they're getting their care in non-continuity type of practices, such as using either urgent cares or sometimes even more disastrously, the emergency room itself for primary care. In primary care, one of the big visits is the annual wellness visit.
Sure.
Can you tell us why that's important for everyone to really establish a primary care for this annual wellness visit?
Yeah, I think that a lot of people, there's a shortage of primary care doctors, and there's a kind of idea sometimes amongst healthcare systems that because there's a shortage, people will just find you. And that's not true, right? We have to do things like this so that people are aware that our medical group is here and we're ready to take care of you.
Sure.
So you can find your way there. And then, a wellness visit, whether it's, viewed as the physical exam of someone who's young, which is just checking in with me once a year. So we're following up on things, and I get more information about your family history, what's going on with your mom and your dad, who I may take care of too, which may change your history now and what we have to do. Or when you get over the age of 65 and you join Medicare, there's also, an objective way of getting patients in who are on Medicare so that we can make sure you've gotten all the preventive care you need. Yeah. And you're usually at the time in your life where you're going to get more health care than you have before as you age. So it's a really good way for us to make sure every year we're on the right path and we're not missing anything that could become a bigger problem for you.
So we talk about basic wellness, or the annual wellness visit, sort of the check-in every year, but what else is the primary care physician able to do for patients as they go through the year?
I think that a lot of people, the one thing that tends to happen is you get sick and you don't have a primary care doctor, and all of a sudden it's, I got to see somebody, and you have no idea where to go.
Yeah.
So one is, having that relationship, I think, is great, because now you know who to call. You're going to be cared for, and you can be more comfortable going to a place you've already been and you know everybody. Secondarily, you may be on medications, and we need to follow those things throughout the year. Just because you get diagnosed with high blood pressure doesn't mean it's okay for 364 days until you see me. We kind of want to see a little bit more than that.
Yeah.
We want to make sure your medications are what they should be. And particularly, if you're someone who sees specialists, the way that I become the quarterback is I see you at intervals to catch up on all these things.
Yeah.
And we're sure about where you're going in the healthcare system, and that you're on the right path.
And great transition, and we did not plan this. No, truly, we didn't plan this. We didn't plan this. But when we talk about primary care and specialists, that handoff back and forth, taking care of the ball if the patient's at center, it's a really great relationship. I mean, it's beyond simply, computer referrals. There's more to it with the specialists.
Oh, absolutely. I like to use the example of Dr. Alex Palesti. He's a general surgeon. He works in my office.
Okay.
So if I have a patient who I, let's say, diagnose with a gallbladder disorder, you've got a stone in there, that gallbladder's got to come out, I can walk you down the hall to Dr. Palesti. Yeah. And we follow up on you together. If I have someone who I diagnose with cancer, I know Dr. Medrano, I can call her at any time.
Right.
We're very integrated with all of our specialists. I know the guy who runs the emergency department here. I know the guy who's the chief medical officer here. And I think that that's one of the benefits of us, is that we do that really, really well.
How does that help the patient?
I think that our healthcare system is very complex, and it's not getting simpler. It's just where we are in the world right now. So as a patient, I think I try to put myself in the shoes of, I go to my primary care doctor, I trust you, I know what's going on, you diagnose me with a problem, and then I walk out of the office. And some people, when they walk out of the office, they feel like, well, now what? I know I have a referral, but what happens? You know, and I think that when I'm able to explain to you, because I have a really good relationship with a specialist, it's going to be, this is where you're going, this is when you're going there, this is what to expect. If you have any questions, you call me, and I can call your specialist, and we'll talk about it, and we'll figure you out, and someone will call you and contact you. You can go into My Chart, which is our online tool, and you can follow along with all these things that are being done, and you can feel really secure that you're being cared for in the right way.
Which is truly amazing for the patient. The level of interactivity. I mean, for me, for a patient to be able to say to my primary care doctor, hey, who do you think I should go to? Number one, there's already that trust factor with my physician. And then number two, it's letting them help me decide what that next level of care is. And you have access to not only, not only, for example, Dr. Alexander Pilesti, but you know the other general surgeons. And you're going to say, hey, this is going to be the right person for you. Because you know the patient. You know what sort of their circumstances, the surrounding areas, the social aspects, the medication aspects. And you're going to say, this is the right one, as opposed to them going through and saying, who's the orthopedic doctor? But you're going to send them to the right knee person. You're going to send them to the right hip person, or the elbow, or the hand, or the finger, as getting that specific, which allows you now to really help guide them to get the best care that they need.
I agree. I'm a believer in a saying in medicine, which it's not every patient for every doctor, and every doctor for every patient.
Right.
And that doesn't necessarily just even mean personalities, because personalities should mesh, because it works best that way. But also, you're right, knowing, because I know you, and I know what you value, and the patient autonomy aspect of what you care about. I know the right doctor for you in that specific circumstance. And I agree with you, that's incredibly powerful for you getting care the right way.
So we talked about the patient. You're going through, you're seeing them, you're doing these annual wellness visits. You're a general practitioner, you're primary care. That book of internal medicine is a thick book. It's now, I think, 2 volumes. Harrison's Internal Medicine has become 2 volumes. And how do you keep up with trends, with new diagnoses or new medicines? How do you manage your own continuous education?
Yeah, that's a good question, because as you have taken the internal medicine board exam, it's about 9 hours to get board certified. And they can ask you any question in the world. And what I do, because I'm a very busy physician. So the 2 things that I find really valuable for me to keep up. One is we use UpToDate, which are peer-reviewed articles, which are integrated actually into the electronic health record we have. So if I'm thinking about something, I need to check a dosage. You don't have to go to the library for the book now. You can go right into UpToDate and know. And then secondarily,
and it's on our phones.
Yes,
we are connected.
which brings me to I guess I'm kind of in medicine we're all kind of nerds, I think, in some way.
A little bit.
So I have on my cell phone something called MixApp, which are questions. They're board questions. And I try to do a few anytime I have downtime. I just do the question, read the articles.
Amazing.
And it's a really great way to keep up, because you're right. Medicine expands every second. I think the doubling time of knowledge in medicine is something like a couple months. So it's truly incredible.
It is incredible. And it's not only about learning new. It's about updating our knowledge.
Absolutely.
One of my professors used to tell me, in 20 years, what you know now is going to be very different than what's going to be truth in 20 years, just because we're evolving as a field all the time. And so you keeping that and I know MixApp is sitting there, and we're not paid by MixApp, we're not paid by Up to Date, but these are the resources that we use commonly to keep ourselves on our toes, specifically so that our patients know that they're getting the right care.
You know, and I'm really glad you brought it up, because I think that this kind of puts a pin in what we've been talking about, which is that medicine, as you know, as an internal medicine practitioner, it is very, very rarely black and white.
Yeah.
A lot of it is gray areas and judgment calls based on experience and the knowledge that you bring and what the patient brings. And I think that that's kind of what we're driving at in this conversation, right? Is that primary care is, medicine is difficult. It's not black and white. It requires a lot of judgment, and it requires you to know your patient really well.
Yeah.
And you know, we have all the resources to get the knowledge, and then you have someone you trust to guide you through the gray area to get you to the right place, whether it's a specialist, a system, whatever the case may be.
We talked about access and the challenge of access. How have we been working to eliminate the access problem?
So first, we've hired new primary care doctors, which
go.
is great, right?
We've got more doctors.
So we've got more doctors coming.
Yes.
Which always helps. We're always looking to grow and expand, so that we can, you know, provide more care to more patients. So we do a lot of things where we try to find, you know, times where we can do sick visits, special in the day. I don't know any of our primary care doctors who are not willing to add on to their schedule same day or next day at the worst case for sick visits. And we're expanding our practices. So my personal philosophy has always been, if you're my patient, I want to try to get you in within the same day or the next day if you're sick. And if you have a, you know, routine problem that you want to see me for, a week, no more.
Yeah.
And that should be our policy, and that's what we're working to always achieve.
So I think the other piece of the puzzle is our access line for patients to call into. Because it's great when they already know. Like for me, if I need you, I'm like, okay, Josh, when can I get in? Let me see you next time. But what about for new patients who don't know who to go to? They come to our emergency room, or they'll go to an urgent care. They might get a month worth of prescription. What's their next step from there?
So we have an option called 833 CU Now, which there's a billboard on 84. If you haven't seen it, you don't drive on 84.
It's out there, and I'm sure we'll put it on from our post to link it together.
Yeah, and you know, there's a team that answers the phone there, and what they're able to do is find out where you are geographically, and then which physician kind of would be best for you in that geographical area, and then get you set up with an appointment, right? Just right then and there, make it easy.
Beautiful, and that's the struggle, because we want patients to get the access. We are opening up access, and we are trying to educate on how to get to the right spot.
Absolutely.
Being able to find the right physician is a big challenge. Even in our hiring, we run into some people that just may not be the best fit.
Correct.
And so it's important that they mesh with our team. And then once we have those, thankfully we've been able to get a few. Yeah. We're able to get the patients in as quickly as we can for them.
That's, I think, the name of the game is, you know, one thing that has always struck me about St. Mary's, been here for a long time, is that the physicians are great doctors. Yeah. They're people who really care about you, and they're very, very well qualified people. And we look to hire people who are just like us. Yeah. Caring, well qualified people. And then when you do that, then we've got to get them in to see you. And that's what we want to do as fast as possible. We don't want you to wait.
That's wonderful. So I want to cap off our conversation with something I like to ask, sort of leave it open to the physician. A nugget of wisdom, pearl of wisdom for our viewers on primary care.
You know what I encounter frequently, and I think everybody should just keep in mind. People are afraid to go to the doctor, and they're afraid to go to the primary care doctor. Right. So you put it off. And in my experience, 95% of the time, it's never as bad as you think it is. You're not dying. There's nothing crazy going on. It's
not a Google diagnosis.
No, you have a small problem. 9 times out of 10, or you just require a little preventive care. Sure. And you know, that's going to help you far, far more than sitting and worrying and kind of thinking something's wrong, but not actually talking to an expert in internal medicine who can help you figure that out. So if you have a family history that's a little bit scary to you, or you've got a little problem that you're kind of not sure, maybe I'm going to put it off, or it's just been a long time, don't put it off.
Yeah.
Come in and see one of us. We can take care of it. And you're going to live a lot longer, a lot healthier life, and have a lot more peace of mind at the end of the day.
That's a piece of wisdom for sure. Thank you so much, Josh. Really
My
appreciate
pleasure.
it.
Thank you.
And thank you all for joining. Have a safe rest of your day.